Other than the discomfort, I would probably always want my own tissue. That is the gold standard. If I'm going to really build gum tissue back up, I will prefer to use this person's own tissue.
Will you repeat the question?
If we're treating gum recession and we got to graft an area and build some gum tissue up, should we look at some type of synthetic, something we harvest from another person, or do we do an autograft in which we harvest from self? Typically, those things we harvest from self, whether it's a bone graft, a gum graft, or whatever, tend to have some of the best survival rates. They obviously are going to be antigenically similar to us, so we're not going to reject them. So it's typically always going to be the gold standard. We can certainly, I remember when I first went into this profession, a lot of people say, well, I didn't like having that other surgical sore in my mouth. You know, that's kind of uncomfortable. You're harvesting the tissue from that area. And so at that time we would do freeze-dried skin. Oftentimes that was our substitute. And typically what it was you obviously got to harvest the skin. At that time it was West Pacific Coast Tissue Bank. Essentially it was what we called the Mexican butt graft, because they would take the skin off of areas of the body that was hairless, free of pigmentation. So when you put it in, you know, you didn't want hair growing in your mouth type things, which we have seen. But as it has evolved, I guess the one right now that is the big one is mucograft, because now we can essentially grow skin in a lab. Alloderm was one of the first ones. Now it's mucograft because it's a thicker connective tissue. They work. I tell you, however, they don't work as good as the real McCoy. And if I have my druthers, I'm going to have the patient have a pizza burn on the roof of their mouth for 3 to 5 days, because that's where I'm going to go harvest it.